We have to work more together in terms of foundations, all together, create a global myeloma initiative between my French foundation, FFRMG, the English one, Myeloma UK, where the UK has a lot of issues.
A lot of challenges.
A lot of challenges in the UK, including access to drugs, which is not an option right now, and where Myeloma UK, worked a lot and helped a lot of people. The US, so on the foundation side, we have this global myeloma initiative on the foundation side, and then work with, indeed, pharma companies and work with the governments and the healthcare systems. Because if you shorten, indeed, the research time by having more money into fundamental research, find something. If you shorten the clinical trials and have expedited the FDA approvals for some of these drugs, like Rousseau, Jean-Luc, showed as well at some point in some of his presentation. And if you basically, indeed have insurance companies, pharma companies that lower a bit the price of their drugs, then you increase the reimbursement or the access to these drugs. So you solve the UK issue. You solve a number of issues with people that have this chronic disease that are not taken or not able to get insurance for that disease. And so there's a number of issues whereby we have to shorten and we have to get more, people working together in a closer manner.
I agree, and I think the challenges that are faced by access to the new drugs is a very critical point, and I think you're absolutely right. What the US brings, and we bring folks like the IMF who are tremendous, Susie Novus, Brian Drury, we have MMRF with Kathy's leadership, of course your own foundation, Myeloma UK, and others coming together. These are very powerful in unison to deal with regulators and bureaucrats who have to understand the nature of what we're facing and how we must overcome it. I think Professor Rousseau touched on some fascinating points as to how, from a health economics perspective, these medicines are expensive. They're very expensive to develop. They have great value. And the important message is, how can we rationally contain and make costs manageable, but at the same time recognize value? Because it is a germane point, it was raised at the meeting. If you just look at the sticker price of a medicine, it's completely misleading. What's really important is what is the impact of that medicine on the natural history of the illness, and how much does that result in an overall saving, not least of the patient, but most importantly as well in the bigger sense of the word. Exactly. So the balance of costs are very relevant here, and I think that using the UK as an example, it's to me absolutely paradoxical that a leading nation like the United Kingdom has limited access to new drugs, where the clinicians, very troublesome, where clinicians are literally hamstrung in what they can offer patients. To the extent I listened to an absolutely heartbreaking case at a recent meeting in the UK of a young woman who went through multiple orthopedic procedures, multiple ICU admissions, had limited access to new drugs, which could have absolutely changed those outcomes. The actual, and just independent of the poor lady's suffering, just the cost of everything that went wrong far outweighed the cost of any of the medicines she should have had access to. And until we can start to really measure that properly and have a very honest discussion in the health economic space, this is going to remain a huge challenge. And thank God in the US we're lucky, we don't have that yet. Hopefully we never will. In France you have a much more civilized approach to this, I think. And I think at the same time, it's time for countries like the UK, with the leadership of people like Eric Lowe and Judy and Myeloma UK, to really engage the government and say, wait a second, let's fix this.
Yeah. No, I think Myeloma UK definitely touched on this big issue in the UK, but you're right. But I think this disease is a very rare disease, and we have to be like wolves against the devil.
Right.
We have to hunt.
Yes.
As a group.
But to be fair, it's not as rare as you might think. I mean, for example, in the US, 25,000 new cases a year, which is
22 and a half,
Well, okay, 23, well, rounded, 25. Yes. You're right.
Half of them die every year.
Tragically, and that is a very sobering figure, 11,000 deaths still a year, which tells you, that tells you that this remains a huge challenge. And I think on a very hopeful note,
if you have good doctors like you can survive like me slightly longer. If you don't have access to the latest drugs and the best doctors, your survival rate goes down big time. And I'm very afraid, because this is also a disease that targets a lot of black people, African Americans, as you call them in the US. We call them, black people in France. Twice as many cases, with them. And in Africa, very little diagnosis. Obviously not a lot of drugs and not a lot of doctors that are focusing on this disease. Asian Americans or Asians have twice as less chances. Ashkenazi people have 1.5 more chances of getting it. So, you also have to adapt what you do, where you do it as well. But overall, we have to find a cure to this disease. It's been going on for too long, and I will never stress enough how much. So, for instance, it's interesting, I get emails or invitations for cancers that are, very, very well known, and where people, have a much, higher chance of getting out of it. We have no chance. Yes. So let's get to already the possibility of some of us getting a chance of not dying from it, yes. Which is what I would like to offer. Not that I have a kid, I try to be more responsible, and indeed, as you know, people that have myeloma have twice as many chances of having their kid having it. That's a very rare, and hard number to get to, but that's the truth. And so I don't want him to get it at any time. And if he does it, if he does get it, then I want him to have a chance of potentially getting out of it and surviving it. I don't care about me, but I care about the others. Yes. About my friends that may have it or that have it. The French President Pompidou died of a rare form of cancer, of myeloma. The Shah of Iran as well. They're very famous people as well that have it. They don't have, how to deal with it sometimes. We want to help them in any way possible. Show them that we're doing everything possible on the research side, showing them that we are smart enough to get together with all the people that are involved in the disease, pharma or insurance companies or governments, doctors like you, of course, that are the nerve of this whole ecosystem, and whatever we can do, definitely we will do, or some of us will do, of course. But we'll never be grateful enough for just you offering us a few years more. And I guess the only commodity we have is time. All of us, that's what we have. And so, yes, we try to work, we try to do the right things by us, but as much as we can help you giving us more time, we will.
Well, Vivien, you could not have said it better, and I would only say that from my perspective, it's a privilege to care for people like you and to be part of a global mission to beat this disease, and it's a privilege to work in an environment with such outstanding partners in every sense as we go forward and fight this disease. And thank you, Vivien, for all you do. Yeah.